I'm Dr. Jonas Bromberg, and today I'm going to talk to you a little bit about medication safety. If your child is prescribed medication, as a parent it's important to sit down with your child and talk to them about the medication, what it is, what it does, what they should expect from it. You want to talk to younger children a little bit differently than you'll talk to older children. With younger children, you want to be fairly simple, concrete. Older children who understand what medication is and how the body works in a more complex way, they may have different types of questions and concerns. But the real important thing is to just let your child's questions guide you. Really listen to them, and their questions will kind of clue you into what their concerns and worries might be. Typically, at first, medication will be prescribed for a trial period, maybe a week or two, so that the prescribing doctor can get a sense of how effective the medication is. So they'll want the parent and the classroom teacher to report to them about the effectiveness of the medication, any side effects that the children might be experiencing, and then with that information they can adjust the dosage as needed, either raise or lower it to get the desired therapeutic effect. When you sit down to talk with your child about medication, timing is really important. You want to choose a time that's kind of a relaxed time where there isn't a lot of competing demands for your attention or the child's attention. It's not necessarily a conversation you want to have with a child right before they go to school, where they might be preoccupied with some of the conversation and not be able to attend and focus on the school the way they need to. In the same way, you wouldn't necessarily want to have this type of conversation right before bedtime. Child might stay awake, worrying and concerned about things. So again, finding a time where there aren't competing concerns or demands on your time or the child's time. Most children won't want to sit down and talk about this, but let them know you're available. Let them know if they have questions and concerns to come to you at any time. And if you don't know the answer, it's okay to tell your child that. It's okay to say, listen, I don't have the answer to that question. I know it's important to you. I'll find out the answer and let you know. The safe storage of the medications that are prescribed for ADHD are becoming a source of increasing concern as these medicines become more frequently abused or misused. Experts recommend that these types of medications are locked up. The medications that are prescribed for ADHD, many of them are stimulants, they're controlled substances, and they need to be kept from people who might seek to misuse or abuse them. While you might be 100% certain that nobody in your household is going to take and misuse the medication, you're responsible for protecting them from anybody in the household. Your child's friends, people who come into your house to work on something or to clean, any kind of visitor. Somebody who would abuse a medication like this isn't always obvious. And so if your child is prescribed these types of medications, it's really your responsibility to protect and ensure that they're not available for misuse. If your child is prescribed a medication for ADHD, it's important to talk with them about what to do if someone asks them to share that medication. While that may not be a great concern for somebody with younger children, if your child's in middle school, high school, or college, it could very well happen, as these drugs are sometimes perceived as performance-enhancing drugs, that they help concentration, focus for study. So it's important to teach your child, how to say no, refusal skills. It's important to teach them that medications prescribed for them are prescribed specifically for them and that they wouldn't be safe for somebody else to take. In teaching your child what to do if somebody asks them to share their medication, it's really important to sort of practice with them different ways of saying no, to kind of imagine the different types of situations where that might come up and role play different ways that the child could refuse or say no to the person asking. It's also important to teach your child to let you know if somebody has asked them for their medication, so that you can talk to them about what that experience was like for them and how they might handle that again in the future. So by rehearsing this and practicing with your child, you'll be able to teach them to say no with strength and confidence, and not to feel bad if they say no to a friend, or and how to stand up for themselves if they feel pressured to share their medication. There are a number of different side effects that can occur from ADHD medications. Most of them aren't serious, but it's important to know if they're happening, and to be able to report those to the doctor. Some of the most common side effects are loss of appetite. And typically, this is something that happens for children around lunchtime. Most children take a medication in the morning, and so the appetite suppression effect of the medication most likely occurs around lunchtime. Some children experience headaches when they take these medications, or difficulty sleeping. Some kids get an upset stomach from these medications, so taking the medications with food is important. And some kids, especially in the late afternoon when the medication's wearing off, go through a brief period of moodiness. They might be especially cranky or sensitive toward the end of the day when the medication is wearing off.